Our IC, which states surgeon heals thyself, holistic well-being of a surgeon. Well, the holistic well-being of a patient is a well-discussed topic, but well-being of a surgeon is something which is always a neglected entity. Surgeon just doesn't mean the physical aspect, but the spiritual, the emotional, the social, the mental, every balance is important to overcome the stress and to perform the best and give the best to the patients. And so through this instruction course, we would be stressing upon the importance of well-being of the surgeon with respect to both mind, body and the soul, so which helps us to make ourselves better. At the outset, I would like to thank all my co-instructors, and now I would like to have our first co-instructor, Dr. Chaitra Jaydev, who is the head of Vitro-Retina department in Narayan Netralaya. She would be talking about resurrecting the fitness in a surgeon. Over to you, ma'am.
Okay. So, good morning, Dr. Jyoti and Deepti. Since we're just two of us in the audience, I might as well address the audience by name. So, I think both of you all are quite aware of this talk, resurrecting the fitness in a surgeon. I'll just go briefly as to what I do. The intention of, I think, fitness for us is to picture ourselves healthy for the longest time possible. Shaping up the plan on how to shape up and finding the finest hour to get fit. I think those should be our goals, not really just going by cliched things that early morning is best, evening is best. I think we should find our comfort zone to shape up ourselves, to keep ourselves healthy for a long term. So if that's the most important goal, because life is a one-time offer and we need to use it well. It's not like, this buy one, get one offers that we keep getting all the time. We just have one life. Let's use it well. Well, our careers are in full bloom. We are very busy. Our kids are all growing up. Some of them are even taking entrances now. And we have a hospital or a household to manage. Like Deepti, for example, doesn't only need to run her household. She needs to run a hospital herself and then again take care of her extended family. So I think that's very, very important. In between all that we need to find time. And we all agree that life is so challenging and so demanding that we may not really have the time because we're very, very busy. But just because we're busy, something has to be given up, whether it is exercise or not. I think it's a decision you need to take, because irrespective of all the other dynamics, exercise is something that works for you. It keeps you healthy, keeps you your quality of life very, very good. So you're left with either three choices. You play the martyr and pretend that you don't really need to exercise, which is really wrong. You can keep saying, I'm so busy taking care of the kids that I don't have time for myself. Figure that there's a tomorrow and you'll get around to exercising next week. Well, that never happens because it becomes next month and next year before you know it. Or trying to find ways to include the much needed exercise in your overscheduled life. I think that's what we need to really discuss today. Now, why shouldn't you give up? Because you can go through the rest of your days on earth without exercising, but you'll have a shorter lifespan with a poorer quality of life. So why compromise? And the quality of life is important for us because we are not just stay-at-home, mothers or fathers. We really need to keep moving, and that requires a lot of energy and enthusiasm. And unless you're up to it, you won't really be able to make it. And also, you can turn back the hands of your clock. I think all of us do get these, compliments on and off saying that you don't seem to age. You look the same since I last saw you, and you're reverse aging. Your daughter looks like your sister. So why shouldn't? That's several of the reasons why we should not really be giving up. And of course, there are several benefits of exercising. I think as doctors, we're all very aware of it. I'm not going to go into the detail, but I think the most difficult thing is to start. And then once you start, the hardest thing is to stop, because at one point of time, you become so keyed into going to work out on a daily basis that you don't want to stop, and you find, ways to skirt around your social commitments to ensure that you fit in a little bit of workout. So how to begin is like you make a commitment. It's very simple. It's whether it's 5 minutes a day or for 5 days a week, it's extremely simple to make that commitment. And once you start and you start seeing the benefits of even that 5 minutes, you're going to want to keep increasing it, maybe 15 minutes, and then you go for half an hour. And then it's there in your system, and that's most important. And why do people stop? Why you need to have a little bit more patience? Because the results are not immediate. You need to give it some time, because we're all so used to things happening instantly in this world that we want results also to be instant, but it doesn't happen because it's taken us some amount of time to get to that point, where we are now going to put in more effort. So give it time. It takes about 4 weeks for you to see that your body is changing, about 8 weeks for your friends and family to realize, and it's about 12 weeks for the rest of the world. So you have to keep going to make sure you reach your goal. And making them realistic is very, very important. You can't have something so high funda that you can't manage it with your own physical limitations. So keep it short. And once you start reaching short-term goals, then you start extending to long-term goals. And then we do have a lot of years to catch up. It's not like, we just need to do it in the next 1 year or so. We don't have acute conditions that we need to reverse most often. So what are the short-term goals? It could be simple ones like walk for 30 minutes without stopping. That itself requires a lot of patience, if not fitness level. We tend to give up after 15-20 minutes. So find a walking partner, listen to music that you like. If you can't go outdoors and walk because it's either so hot or it is raining, then you find a place in your basement, on your terrace, wherever it works for you. But then move it to 1 hour without stopping. Or it could be another short-term goal of losing 2 kilos. Say just before AIOC, I had a goal that, I want to get into that particular dress or that particular sari I wanted to wear for one of the talks. So, have these goals so that you can manage to reach them in target time. And quit smoking. I think that's, if any of y'all are smokers, that's a very, very important thing that adds to overall poor health. Drink lesser alcohol. I know it's difficult to do these things in short term. So have small goals and then improve on them. Of course, long-term goals could be that you exercise consistently for the next 1 year, lose 5 and then 10 kilos if that's your target, drop dress sizes, get into your favorite dress again, run that 10-kilometer race, lower your blood pressures, play a parent and child tournament. The one doctor that I know who's done that is Dr. Barunai. He got so fit that he and his son and his daughter played doubles. So it's so nice to be able to play a tournament with your own child. Find the local hill. Maybe you'll reach halfway and then eventually after your fitness increases, go to the peak of that hill. And join an exercise group because that's what works for me. We tend to push each other. If I'm not in a mood, 2 other people will say, no, come on, we'll go. Even if it's not for a full hour, let's at least work out for half an hour. That's very important for you to get yourself motivated. Every beginning is hard. It's not necessarily that you'll be able to do it in full, not only because it's in the mental game, but also because you're going to have aches and pains. It's not like the minute you start, you're going to become so fit that the next day from 5 kilos, you'll go to a 10-kilo dumbbell. It doesn't work like that. Make small beginnings and steady beginnings. I think that's very, very important. Maintain it for several months and then you can always scale up. So these are simple ways on how, but try to put in a little bit every day. I think that's most important. Now, be realistic. Means if you have to visit every morning to your club, make that commitment. 30-minute walk during a lunch break. I don't think any of us have these luxuries, but we can still try sometimes. This is what I was saying. So you can get a stationary bike. You can always try to do it a little bit after dinner. It doesn't have to be very aggressive, just a short ride. We'll burn off few of the calories, stroll through the weekend in a park there. Or at least 4 times. That should be minimum, and then you can aim for 7 days a week if you can. But I still feel an ideal time is 4 to 5 days a week, not longer than that, because your body needs some time to recover from the small strains that it would have happened during your workout periods. And this is what research has shown, that at least 30 minutes a day is more than adequate to get yourself going. And when you work intensely twice a week, it also helps. And thrice is nice. If you can manage, 3 to 4 sessions will greatly improve. And then 5 to 6, move up your fitness level in ways that appear to be revolutionary. So this is how 30 minutes, 5 to 6 periods, more than adequate. Right? Change your habits. I think that's important because you can't really want to be yourself and still make a change. So make small changes. If it's about getting 15 minutes earlier or sleeping a little bit later or, wearing shoes and walking. We're just not used to it, some of us. And find the right time. Any time is a good time. Some say early, some say late. Well, whatever works for you is the best time to exercise. and staying consistent. I think that's again very important, especially when you're in a physical workout schedule, because it sets you back. The minute you take a long extended break, it sets you back, and to get back into that mode is quite difficult. So be specific, be measurable, be attainable, be recordable, and timely or tangible. I think that's a smart way to get moving and get fit. Make that investment. So these are some of the places where I have invested in gyms. I've invested in dumbbells. These are all my personal dumbbells. Sometimes you don't get that particular weight that you want, so I've bought a couple of dumbbells. These are all friends. I have people ranging there from inching closer to 60 to probably some who are 16. So they are all the ones who keep you motivated. And make your spouse a partner. So this is my husband and mine workout day on a Valentine's Day. Is like, bring your spouse to workout day, and this is how he was. So you see, there is a difference when you put it together. You can see the difference in how we have started coming down to now. So a gradual, consistent workout has reduced at least his weight by almost 15 kilos. So that really makes a difference. And then get your children motivated right from the very beginning. So some of them were during COVID, where we used to put the cult workout and the kids used to work out at home, and then we used to take them to the gym and both of us go. So they at least get into that mindset that, working out is not a strange thing. And then there are no excuses. This is when I went for a short fellowship to the US, an ICO fellowship. I enrolled in a local gym there. So this was like a cross racial group where you can see extreme difference in our fitness levels. Some of them are so good, it's unbelievable. So, and stay focused. You need to strike a balance, so you keep at it. I think that's about it. So these are some points on how you have a solution for every excuse. It's quite a long list, so I'm not going to go into that. So this was when they asked different specialists. The ophthalmologist said moderate and regular walks, healthy minds lead to a healthy body. So they asked each one of the specialists. Anyways, it's never too late. Let's make a strong beginning. I'm sure it's going to make wonders to us. Thank you so much.
Your talk, I do something for 6 months and then I'm the least motivated person here, but I think year by year with your talk, I stay motivated is what I would wish to. And now the next one, as a woman, we all face a challenge of managing both home as well as the work, and that's where maybe what Chaitra ma'am mentioned, the exercise and all takes a back place. So managing work-life balance, we have with us the head of the Department of Pediatric Ophthalmology and Strabismus, Narayan Netralaya, Dr. Jyoti Matalia ma'am with us, and she would be guiding us as to how to make things more easy for any woman who is been working. So over to you, ma'am.
Thanks, Deepti. Yeah, that's true. Actually, every time I hear this talk and I feel, yes, we should get motivated. I've seen Chaitra when we had gone to the US. Even there, she would get up in the morning and go for runs, remember, in Seattle? So I was like, yes, yeah, I'll do that one. Sure. Yeah. So let me help you go through how we can have a work-life balance. So this is something perfect we would want to have in life, but it's never going to be a perfect work life. So what are the various aspects that we are looking at when we are talking about a work-life balance? So there are 5 things that I will take you through. First is career, wealth, fun and happiness, family and friends, and health. So all this together, if you are able to get, then we are going to get a perfect work-life balance. So let's go ahead. So let me talk in terms of my career and then take you about what all I look at things to try to get a balance in life, and that will help us. So starting with career. So I did my LVP fellowship, and after that it was like success, career growth going simultaneously. And what I felt is doing the fellowship alone among my counterparts, I could stand apart. So that was my first thing, to do something different, to get a fellowship. And then I joined Narayanita in 2006. So incidentally, before I did my fellowship, I was in Mumbai and I was doing topical phacos. But I always felt that I had to do something different than that, something better. In clinically, I was not as good, and that's the reason why I did the fellowship. And that helped me stand apart. Then since 2006, I'm in Narayanita, and I can see that the graph is going pretty good, and I'm very happy with it. But let us understand, we cannot confuse having a career with having a life. What we need to do is take responsibility of our life. That is it. Wherever you're working, we are responsible for our life and we have to work on it. Now, there are 2 types of workplaces that we look at. One is our own private practice where we set our own boundaries, and the other is either an institute, which should be government or private or corporate, where somebody else puts a boundary. But that is not what we should allow to happen, and that's the most important thing. Coming back to a private practice, you can't do a good job if your job is all that you're doing, and that's what we should remember for anybody. So how do you go about? Delegate responsibilities in your practice to others, groom your next line, have faith in them and let them grow and let them fall, and that's how they will, but keep a watch on them, but let them get the entire authority. Have a team building activity to make them feel at home. Make a family with the team, giving them an equal responsibility, and that will really take up your path up. The second aspect, as I said, is about the other institutes, what we are in, or institutes, etc. So most importantly, love your work. Take ownership of whichever place you're working. That's the key to success. Now, as Nigel Marsh has said, there are thousands and thousands of people out there who are living lives of quiet, screaming desperation, where they work long hours and hard hours and for a job that they hate, to enable them to buy things they don't need and to impress people that they don't like. So that is not what we should do. What we should remember that more than 50% of our time we are working in a place, so it's important that we enjoy life. So if you notice, the amount of time you spend at home is relatively less compared to what you do at workplace. So try to enjoy. There is where you're spending the most time. Enjoy the time with your colleagues, subordinates, and staff. Celebrate occasions, small things which will not only give them happiness, but give you happiness at all as well, and you will stay happy too. So that is a basic line. So what you need to do is design your own life. Wherever you are, in whichever practice you are, you should be able to design your own life. Now, coming back to the important thing is wealth. Yes, everybody looks for wealth. We always think that there's a perfect work-life balance between work and life, but this is not how it is actually there. Never get so busy making a living that you forget to make a life. Yes, money is happiness, but not all the time. What you need to understand, there are certain things you cannot buy with money. Coming then to the other important thing is fun as happiness. So look at very, very small things that you can get joy in. Like for me, I would watch the sunset, unplanned evening with coffee with hubby suddenly on the way back home, Sunday long drives, beetle ride which I took. I spent a good amount to just go for a beetle ride in Lisbon when we had got. But there are small things which I really love. Having a gourmet lunch and spend a good amount there, having a nice food, because I'm a foodie, I do that. Even eat cotton candy and do that with my children, fight for one, ice cream and pickwicks. Something small things, but when I do that, I really feel happy. So the idea is enjoy every moment and live in the present. Don't base your happiness off other people's life. You feel that person is more successful or that person's better life. You never really know. Do what you have to do. Never compare your life to others. There is no comparison between the sun and the moon. They shine when it's time. It's their time. So never do that. Do what you feel you're going to be happy with. Also, there are certain different people have different needs to be happy. Some people like a lot of exercise, a lot of greens, no social media, some meditation, creating art, daily routine, lots of sleep, food for the soul, yoga, alone time. So there are different people doing different things. Do what works best for you, because you should know living is more important than making a living. Then coming to the most other important part of our life, the family and relationships. This is very important. What we should understand that they are major support for us, and we should never forget them. Other things may change, but we start and end with family. Family is not an important thing, it is everything. So never take them for granted. Love your family, spend time, be kind and serve one another. Make no room for regrets. Tomorrow is not promised, today is short. Today's goal, prioritize your family. Let them know you appreciate them while they are here. And that's important. Don't take them for granted. No matter how much they love you, people get tired eventually. And make a point to make them know, because what you are today, what I am today is thanks to my support, my parents, my sister, all of them are with me, and that's the reason why I'm today doing all these things. So let them know it and please appreciate them. And then importantly, health. A healthy lifestyle is very important. And I think Dr. Chaitra has really told us how it is going to be. We need to live longer to make all our dreams come true in our life. And hence, it's important to get in some sort of mental, spiritual, and physical health in our life. It's important to identify sources of stress which is there. Like, for example, the amount of work. Find out what they are, like amount of work and deadlines, relationship with others, office politics, ongoing change, etc. Identify the sources of life stress in your life outside work, like relationship, marriages, finances, too many commitments, etc. And once you're able to figure them out, look at techniques to help, like positive self-talk, If there are certain things that you can do, I can't do this, try to say I'll do the best I can. So something like this will help you go through it. Emergency stress stoppers, deep breathe, or count to 10 before you speak, walk away and go for a walk, find your joy, listen to music, take a class or read, practice relaxations. So these are all what are important. So you should have a perfect work-life balance, which is important so that you can go through these things. Like, for example, for us, it's very important that as women, we are able to handle the household as well as work, and try to not get your stuff in the hospital or in a professional life back to home. Try to segregate the two things. And if you're able to do that, makes it much easier. And what are the other aspects? The key is to not to prioritize what's on your schedule, but to schedule your priorities, and this can be done best. Like, for example, where irrespective of whatever work we are doing, try to go for parties, try to have meetings where you meet your friends, and that can help catch up. Also note that 20% of what you do in your life actually daily leads to 80% of your results. So do the 20% that matters the most and forget the rest. And more importantly, learn the art of saying no. Don't lie, don't make excuses, don't over-explain yourself, just simply decline. And there's nothing wrong in it if that's going to make you happy. So overall, what we need to understand that we just have to be ourselves. Just be yourselves. And that will help us put a work-life balance in terms of a career, happiness, family, friends, and our health. So be thankful of what you have and make the best out of your life. Have a wonderful life. Thank you.
Ophthalmic surgeon.
It's not playing.
All's well, but then
No, I mean, he can hear.
my
No, ma'am, no introduction. I'll introduce myself and finish off. It's okay. The next people are waiting. I hope people can hear this because this is not playing with the speaker of their audio jack. So my talk would be on the ergonomics part. I'll be just playing one small video, and with that, I think I'd be wrapping up my talk. I hope it's heard.
Hello everyone.
Is it heard?
Ophthalmic surgeon. All's well, but then
Anything is heard?
my back. क्या आपके पीठ में दर्द है? क्या आप ergonomics जानते हैं? Ergonomics? Hereby presenting a neglected story of MSD. Oops, the musculoskeletal disorder of an ophthalmologist. According to a national survey, more than 70% of ophthalmologists reported back pain. Why is it so? Let's have a look at a routine day of an ophthalmologist. Be it indirect ophthalmoscopy, assisting OR, slit lamp examination, or long surgeries. We are taught how to examine a patient to his best, but unfortunately, good ergonomic practices are not taught to us during professional training, neither is emphasized during the clinical practice. Reported prevalence of musculoskeletal disorders among ophthalmologists in India ranges from 50 to 80%. Ophthalmic clinical practice mostly involves repetitive tasks with fine motor control and close visual focus, which increases muscular tension in head and neck. Maintaining awkward posture for long hours may be another contributing factor too. Ophthalmologists in the 21st century are equipped with an armamentarium of ophthalmic devices which aid in diagnosis and management. However, if these are not used in ergonomically sound manner, they may paradoxically harm the ophthalmologist rather than benefiting them. Remember, machines and equipments are made to ease our work and not vice versa. So my friends, let's not take a chance. Let's make a change. Let's place the ergonomics as fitting the workplace to the worker and not the other way round. Let's bring a harmony between the man and machine. In our OPD, slit lamps are more patient-centric when in fact each patient just ends up spending hardly 2 minutes for his examination, whereas the doctor spends 4 to 5 hours of his day on the same. The slit lamp are pointed more towards the patient, putting a stress on doctor's back. Rather, shifting the slit lamp towards the doctor and adjusting as shown in this video can put the spine at 5. horizontal optical paths helps us to avoid hunch of the back and neck. The advent of ocular 3D visualizing surgical system has been a game changer in ophthalmic ergonomics by improving surgeon posture and hence by reducing unwarranted muscle fatigue. An assisting surgeon also needs assistance with ergonomics. Shoulder area cutout on patient bed helps for temporal surgeries and allows easy access and additional legroom for assisting surgeon without compromising the patient comfort. All said and done, man behind the machine is important too. AAO has recommended yoga sequences tailored for ophthalmologists which can be referred. Stretch exercises between long surgeries are helpful to avoid muscle fatigue. It is truly said, a little help goes a long way. Back strengthening exercises and swimming helps to keep our core muscles strong and prevents fatigue on long run. Unfortunately, God hasn't gifted with the power to age back like Benjamin Button. So my friends, back your back and it will back your future on a long run.
So with this, I would like to thank Chaitra ma'am, Jyoti ma'am. This was an internal IC instruction course with three of us speaking to each other. But thank you for being with me every year with this IC. It's a real wonderful moment. Can we just have one small pic before we disperse?
In the audience, I think.